I think that, as I said from the beginning, I'm not sure what the Republican goal is, and they seem to have done a pretty good job of making everybody unhappy. So on one hand, there are definitely Republicans who feel we need to protect the coverage of people who have gained coverage under the act. We've got the lowest uninsured numbers ever in the history of this country. And Susan Collins is a great example of somebody who says we don't want to take a step back. On the other hand, you have conservatives who say far too much of the original Affordable Care Act of Obamacare is still left, and we need to roll more back. So I don't know how they move. Right now, I think the numbers are pretty terrible, where you have projected about 14 million people who immediately lose coverage, and then over time, an additional 10 million people lose coverage. And if you go into CBO, what they're projecting is that a lot of older, lower-income Americans who won't be Medicare eligible yet, but just will be priced out of the marketplace. And that is a pretty terrifically bad swing to make in this country, where older Americans will take the brunt of this plan, poorer Americans will take the brunt of the plan, and richer and healthier folks will continue to be fine.
So what do you think are easy adjustments that would matter, that would be of scale? Some have suggested if you did away with the penalty for interrupting continuous coverage, could that reach across the aisle? I see Peggy Noonan's out today saying the president has to make this more of a bipartisan effort. Is there something that you would be happy with?
Well, I think that certainly the level of subsidy, the amount of resources available to people to help them buy their own health insurance needs to go up, and also needs to have some kind of income variation. Right now, it doesn't matter if you make $25,000 a year or $70,000 a year. You get the same amount of subsidy depending on age. The other thing that they've done is, I think, change the age band so that insurance companies in the future could charge older Americans 5 times what they can charge other Americans. Those two issues, getting changed, putting some subsidy money back in, looking at that age issue and what it does to older Americans in terms of their premiums. The estimation is it will add at least $3,500 to everybody's cost. So for me, I'm about covering people, but I don't think that's the main goal of the Republican plan. I think it's to save the federal government money. And if you do that, you then shift costs to individuals, you shift costs to states and local governments, and that's exactly what this plan has done.
I mean, they've argued a number of times, Madam Secretary, that they don't want to pull the rug out of anyone and out from anyone, and they want to give consumers more choices. I know, you're not a stranger to defending Obamacare. This was his legacy legislation, and you were there to implement it. But can you at least sympathize with the main Republican argument that it's too expensive, premiums increasing double digits, it doesn't give enough consumer choices, and it's very complex?
Well, again, I certainly am sympathetic to those arguments. They don't necessarily bear out in fact. Only 3% of the people in the marketplace paid rate increases last year. Yes, premiums went up. Insurance companies adjusted prices, which is not unusual in a brand new market. But the way the subsidies were organized, consumers did not pay those increases. So while the increases are cited, that is not what consumers saw.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.